An abdominal aortic aneurysm, or AAA, is a serious health problem that can have life-threatening consequences if not detected and treated in time. It affects the aorta, which is the main blood vessel in your body, responsible for carrying oxygen-rich blood from your heart to the rest of your body. The aorta runs from your heart down through your chest and abdomen, making it a critical component of your circulatory system. An aneurysm is a bulge in the aorta that occurs when the wall of the aorta becomes weakened and starts to balloon out. This bulge happens when the wall of the aorta gets weak, which can be due to a variety of factors including high blood pressure, smoking, and genetic conditions. AAAs often don't cause any symptoms, which makes them particularly dangerous. Many people are unaware they have an aneurysm until it is discovered during a routine examination or imaging test for another condition. Many people don't know they have one until it ruptures, which can lead to sudden and severe internal bleeding. A ruptured AAA is a life-threatening emergency that requires immediate medical attention. The survival rate for a ruptured AAA is low, which is why early detection and monitoring are crucial. It requires immediate medical attention. Understanding AAAs is crucial for prevention and effective management. You can take steps to lower your risk of developing an AAA by maintaining a healthy lifestyle. This includes regular exercise, a balanced diet, and avoiding smoking. If you are diagnosed with an AAA, you can work with your doctor to manage it through regular monitoring and, if necessary, surgical intervention. Early detection and proactive management can significantly improve outcomes and reduce the risk of complications. Abdominal aortic aneurysms, commonly referred to as AAAs, are categorized in two primary ways, by their shape and by their size. Understanding these categories is crucial for both diagnosis and treatment. When it comes to shape, there are two main types of AAAs that medical professionals focus on. The first type is known as a fusiform aneurysm. Fusiform aneurysms are characterized by a uniform bulge that extends around the entire circumference of the aorta. Imagine a balloon that has been inflated evenly on all sides. This type of aneurysm is the most common and can vary significantly in size. The second type is called a saccular aneurysm. Unlike fusiform aneurysms, saccular aneurysms bulge out on only one side of the aorta, resembling a small berry or a sac hanging off the side. This type is less common but can be more dangerous due to the uneven pressure it places on the aortic wall. The size of an AAA is another critical factor that doctors consider. The size not only helps in diagnosing the severity of the aneurysm, but also plays a significant role in determining the appropriate treatment plan. Small aneurysms are those that measure less than 5 centimeters in diameter. These are often monitored regularly to ensure they do not grow larger, as smaller aneurysms generally pose less immediate risk. Medium aneurysms range from 5 to 7 centimeters. At this size, the risk of rupture increases and doctors may start to consider more proactive treatment options, such as medication or even surgery depending on the patient's overall health and risk factors. Large aneurysms are those that exceed 7 centimeters in diameter. These are considered highly dangerous due to the significant risk of rupture, which can be life-threatening. Immediate medical intervention is often required to prevent catastrophic outcomes. The exact cause of abdominal aortic aneurysms, or AAAs, remains a mystery to the medical community. Despite extensive research, pinpointing a single cause has proven elusive. However, several contributing factors have been identified that can lead to the weakening and bulging of the aortic wall. These factors collectively weaken the structural integrity of the aortic wall, making it more susceptible to aneurysms. Understanding these factors is crucial for both prevention and treatment. One of the primary contributors to this condition is atherosclerosis. This is a condition where the arteries become narrowed and hardened due to the buildup of plaque. Plaque is a sticky substance that can accumulate inside the arteries over time. It consists of fat, cholesterol, calcium, and other substances found in the blood. As this plaque builds up, it can cause the arteries to become stiff and less flexible. This not only restricts blood flow but also puts additional pressure on the arterial walls. High blood pressure or hypertension is another significant risk factor. When blood pressure is consistently high, it exerts extra force against the walls of the arteries. Over time, this constant pressure can cause the arterial walls to become damaged and weakened, making them more prone to bulging and aneurysms. The stress from high blood pressure doesn't just happen overnight. It's a gradual process that can take years, slowly weakening the arteries until they can no longer withstand the pressure. Smoking is another major risk factor for developing AAAs. The harmful chemicals in tobacco smoke can directly damage the blood vessels. These chemicals cause inflammation and damage to the arterial walls, making them more susceptible to aneurysms. The more you smoke, the greater the risk. Genetics also plays a crucial role in the development of AAAs. If you have a family history of the condition, your risk is significantly higher. This genetic predisposition means that if your parents or siblings have had an AAA, you should be particularly vigilant and consider regular screenings to catch any potential issues early. Section 4. Risk Factors. Who is most susceptible? Some people are more likely to develop AAAs than others. Men are at higher risk than women. Your risk increases as you get older, especially after age 60. Smoking is a major risk factor for AAAs. High blood pressure and high cholesterol also increase your risk. A family history of AAAs is another risk factor. Certain medical conditions can also increase your risk. These include diabetes, chronic obstructive pulmonary disease, or COPD, and kidney disease. Section 5. Diagnosis. Detecting the silent threat. Most AAAs don't cause any symptoms. They are often found during routine medical exams. Your doctor may suspect an AAA if they feel a pulsating mass in your abdomen. Ultrasound is the most common test used to diagnose AAAs. It uses sound waves to create images of your aorta. A CT scan is another imaging test that can be used to diagnose AAAs. It provides more detailed images of your aorta. Section 6. Prevention. Taking charge of your aortic health. There is no sure way to prevent AAAs, but there are things you can do to lower your risk. Not smoking is the most important thing you can do. Eating a healthy diet and exercising regularly can also help. Managing your blood pressure and cholesterol is important. Talk to your doctor about your risk for AAAs. They may recommend regular screenings. Early detection and treatment are crucial. Section 7. Conclusion, awareness, action, and aortic health. AAAs are a serious health condition. It's important to be aware of the risk factors. Take steps to lower your risk. See your doctor for regular checkups. If you are diagnosed with an AAA, work with your doctor to manage it. By taking care of your aortic health, you can reduce your risk of serious complications. Remember, knowledge is power when it comes to AAAs.